Good morning, everybody. Today, I'm going to tell about the healthcare system in our country. This is especially designed for the pharmacist who is learning the B Pharma final year. Why it is important? Because until unless they will not understand what is the healthcare system, so they cannot contribute in good manner to the healthcare system in our country. As you know, the healthcare system is a vast healthcare system in our country, but there remain many differences in quality between the rural and urban areas, as well as between the public and private healthcare. Despite this, India is a popular destination for the medical tourist, given the relatively low cost and the high quality of private hospitals. India has universal healthcare model that is mostly administered at the state level rather than the federal level, with each state having their own publicly funded healthcare. The public health system is essentially free from all Indian residents, except for a small, often symbolic co-payment in some services. So it is absolutely free to the Indian people. In 2019, the total net government spending on the healthcare was $36 billion, or it is the 1.23% of GDP. Little bit history of our system and the healthcare system and what is the present. I would like to say that after independence in 1947, the government has made the health a priority in the series of 5-year plan, that is the Panchvarshi Yojana, each of which determines the state spending priorities for the coming 5 years. The national health policy was endorsed by the parliament in 1983. The healthcare system in India is presently administered by the states. India's constitutional task of each state which provides the healthcare for its people. In order to address the lack of medical coverage in rural areas, the national government launched the National Rural Health Mission in 2005. So there is an amalgamation between the state as well as the national government. This mission focuses the resources on the rural areas and the poor states which have weak health services in hope of improving the healthcare in India's poorest region. Very shameful. According to the National Health Profile 2017, our country has only 1 million allopathic doctors to treat the population of 1.3 billion. And even out of it, just 10% works at the public healthcare system. One more shameful thing, according to the World Health Organization, only 1 in 5 doctors in rural areas is qualified to practice the medicine. So, keeping in mind the rural areas, government has launched the NRHM, that is the National Rural Health Mission. The National Health Policy was endorsed by the Parliament in 1983. That was updated in 2002 and then again updated in 2017. So, in 2017, they have focused on the growing burden on the non-communicable diseases, on the emergence of robust healthcare industries, on growing incidence of the unsustainable expenditure due to the healthcare cost, such as the corona nowadays, and on rising economic growth enabling the enhanced fiscal capacity. So these 4 things were focused in 2017 plan. To standardize the entire healthcare system, government has prepared launched the NRHM in 2005. To strengthen the system has since met many hopes and expectations. The mission seeks to provide the effective healthcare in the rural populace throughout the country, with the special focus on the state and union territories, which have weak public health indicator and or weak infrastructure. Toward this end, the Indian Public Health Standard for the sub-center, primary health centers, community health centers, and the sub-district and district hospitals were published in January 2007. These hospitals, the type of hospitals I will discuss later on, right, have been used as a reference point for the public healthcare infrastructure planning and upgradation in the state and UT. So this IPHS are a set of uniform standards envisaged to improve the quality of health and delivery in the country. So uniform standard. Now in our country, we are having the three level in the healthcare system. First is primary, secondary, and tertiary. In primary, which is generally we are having the sub-centers, primary health centers. In secondary level, we are having the community health and community health centers. And tertiary, big hospitals and the medical colleges. Generally, primary level is the first level of the contact between the healthcare institution and the patient. It includes the subcenter and the primary health centers. So subcenters, it is the most peripheral and the first contact point between the patient and healthcare facilities. It has the three employees, one healthcare worker that is male, one healthcare female, and the voluntary workers. For the sub-centers, Government of India, India's Ministry of Health and Family Welfare is responsible for providing the 100% fund for the sub-centers. So it is not a subject of state government. But the primary health centers, it is the first point of contact between the police community and the doctor. It has a strength of the at least 15 people, including the medical officer, a medical health assistant. The medical officer is considered as the leader of team or the primary health centers. Here you can find the job of pharmacist, generally qualified as a diploma, BCom or F.Com. Each primary health center acts as a referral point for the 6 sub-centers, and they have the bed strength of 4 to 6 beds. It depends upon the sub-centers. In secondary level, the secondary level is first referral level, where the patient is referred depending upon the seriousness of issue. It includes the community health centers. Community health centers has the staff of around 30, including the 4 specialist doctors, where should be the physician, surgeon, gynecologist, and pediatrician. 3 main posts have been created under the NRHM program. They are ophthalmologist surgeon, ophthalmologist, anesthetist, and the public health program manager. And of course, in the tertiary, we will talk later, but we have to see what is the scenario of these 2 things, the sub-center, primary health centers, and community. So in sub-centers, the level of care is just primary. Each sub-center is located at the population of 5,000. The total number of staff of the sub-center is 3, and it is regulated by the central government. And the primary health centers, that is also known as the PHC, level of care is primary. Each PSC is located at the population of 30,000. Number of staff is PSC is 15. It is regulated by the state. Then comes to the secondary level, that is the community health centers. So each CSC is located at the population of 1,20,000. Number of staff in CSC is around 30. It is regulated by the state government. So 2 levels of run by the state government, and the primary sub-center level is regulated by the central government. And as far as the tertiary level are concerned, the tertiary level is the second referral level, and it includes the hospital and medical colleges. So this is the Indian healthcare system, which is based on the Sarve Bhavantu Sukhina, Sarve Santu Niramaya. May everyone be happy, may everyone be free from the illness. So here I'm stopping my